Hello, everybody. Welcome to our conversation about health and happiness for employers and employees during the COVID-19 era. Before we get started, a quick word about the fourth floor in case you're not familiar with us. We're an exclusive entrepreneurial ecosystem that connects female founders looking to build out their advisory boards to general counsel and industry leaders who are looking for board roles. We're creating a mutually beneficial exchange of opportunities to rise up women's careers and companies. If you are interested in joining our community, please apply on our website, thefourthfloor.co. We hold many different kinds of events and bring people together even now, although virtually. Today, we're really excited to have Patricia Friedman and Irina Isakova here from Aon. I'll let them introduce themselves, as I'm sure I will not do them justice. They'll be sharing with us how we can take advantage of some of the resources that are out there and available for employers and employees. If you have questions, feel free to stop them and ask. If you're not comfortable interrupting, you can raise your hand or type your question into the chat. We'll be looking through them and then presenting them. And then we'll have a Q&A at the end, but we know sometimes it's hard to come back to it. So feel free to jump in. And let's get started. Patricia, Irina?
Sure. So my name is Patricia Friedman. I'm with Aon in the Health Solutions Group. I'm joined by my colleague, Irina Isakova, who will also be presenting, and I'll turn it over to her shortly. We're very excited to be here. We've been working in the trenches with our employer clients, trying to help them facilitate these very unprecedented times. And what we want to talk to you about today are a number of options that are available to you and your employees that many are not costly at all. In fact, as a result of the pandemic, the whole insurance industry, all the vendors have really come to recognize the difficulty that this is putting on employees and employers. So we want to make you aware of a lot of programs that you can have free and online availability to your employees. So we're going to talk a little bit today about optimizing your existing programs, and I'll get to that too in a minute. Then Zarina is going to walk you through the new normal. So how is it really working at home, particularly if you have small children or others in your family that you need to care for, doing it safely, ergonomic tips. I know that everyone in my house is struggling with back pain and neck pain, and how you can do it really well and stay healthy. Also, how to stay engaged, being socially isolated from your workforce. Then some well-being tips, a lot about mindfulness. We all know this is a very stressful time, both in and out of the workplace. Some helpful tools that we have in terms of navigating resources. And I love this last one, happy kids, happy parents. So that Zarina has some wonderful tips there. And then finally, I'll just talk a little bit about the returning to work roadmap. We know, at least in New York, it's not immediate, but many employers are talking about it, and it may never look the same, but we want to talk a little bit about some of the considerations around return to work. So next slide. So in terms of optimizing programs, so many of you either provide health insurance to your employees, or you are an employee getting services. And so what we want you to realize is there are a lot of new services that are available through your insurance carrier and also through the healthcare system. So I'm sure if any one of you is participating and getting services from a doctor's office, they have talked to you about the availability of telehealth. So there's a variety of means to get that, and you never have to walk into the doctor's office. And many employers and many insurance companies are offering those services for free, particularly if it relates to COVID-19. The other thing we want to make you aware of is many of the carriers offer free 24/7 nurse line. And if you're having a medical emergency or think you might be, this nurse line is a great resource to say, no, it's not a medical emergency. They can walk you through it. It's particularly good for children. If particularly if you're first-time parents in the middle of the night. So definitely use these resources. One note is on the telehealth, you should try to sign up before you actually need it, so when the time comes, all of your information is in there. Then in terms of clinical resources for expectant mothers, including access to neonatal nurses, et cetera, there are a lot of services for that. And just also a note that many of the infertility programs, because it's not an essential service, have been turned off for right now. So if you were in the process, you probably are in a stop mode as far as that goes. Then employee assistance programs. These programs have been around for a long time and have been underutilized extensively. Right now, they are there. You can call in, you can get free visits over the phone with a licensed clinical social worker, psychologist. You can get access to a number of articles and videos, and depending on the type of program it is, it can be talking to you about financial issues, emotional issues, children's issues and resources. So they're a wonderful resource, and many of the organizations have expanded services during this time. So definitely check in on the employee assistance programs. Childcare.
Well, can I interrupt
yes.
you? Just a couple of things I wanted to add. On the infertility services, as Patty mentioned, most fertility doctors today are following the direction from the American Society for Reproductive Medicine on ceasing fertility treatments just because the effect of COVID-19 is not fully known when paired with such strong hormone treatment. So you're definitely going to be hearing more of that and probably a ramp up as this situation sort of comes to more of a control. So I do expect that on your claims as the year progresses, probably plan year 2021. And on the employee assistance programs, I think this is as important time as any to emphasize to employees the confidentiality between their interactions with the EAP service that you provide, be it through your life and disability carrier, through your medical carrier, or a standalone EAP program. Because as we talk to more and more employees throughout the years, the one thing we've always heard is that they're not confident that what they say to their EAP provider will stay between them and the EAP provider and will not filter through to their employer because they're afraid of retribution of any sort. So I think it's an important, as we talk about communication in the next slides, I think it's important to focus on some of these messages that will ring true to some employees who are struggling today. Sorry, Patty.
Thank you. Sure. And in terms of childcare, so as we all know, many of the schools are closed, the daycares are closed. Bright Horizons has a crisis care network, so they do have the ability to provide in-network child care providers, in-home child care providers, and many employers, if any of you are providing essential workers, particularly if you're in the healthcare system and you really need people to get to work, they were providing additional payment for these backup child care days. I think the issue is that most people haven't felt particularly comfortable using any kind of daycare facility or certainly having someone that they don't know in their home. Also, their services for seniors as well. And then as far as legal services go, many employers offer some kind of legal service that provides you will preparation, et cetera. But there are expanded services in terms of what people are doing right now, allowing people a free trial to go in and just do a will very quickly at no charge. So this whole pandemic is getting people thinking about things that they might not have thought about before. And then what we've been experiencing with on behalf of our employers and the organizations, vendors that serve them, that many of them are offering special services, expanded hours, or deferral of payment. So if you are experiencing any hardship as an organization or as an employee, you should definitely try to seek out what services you could get. So, don't be shy about it. Definitely be aggressive, and everyone's trying to do the right thing and help one another in these times. So I'm going to turn it over to Zarina.
Any questions before we move on? Okay, perfect. Before we do move on, I want to point out the Aon Response site here that's available to the public. You can log in there, and our resources are updated on a daily basis. And we do offer a breadth of resources when dealing with employee issues or when dealing with the new legislation that comes into play as COVID-19 situation develops. And we'll put the direct link into the follow-up presentation as well. All right, so we can kick off. So we're all talking about how we're readjusting to the new normal and how we're keeping employees sort of sane as they navigate this situation, right? They're worried about their health, the health of their families, at the same time worrying about the economic volatility and the safety of their jobs, pay cuts, and things along those lines. So we wanted to make sure that we sort of provide you with an outline of what employees can be doing and what messaging employers should be reiterating as the situation evolves. And the most important message that we are seeing that carries a lot of weight is that if leadership is involved in communicating some of the boundaries that employees have been able to accomplish in their work-life balance or are working on accomplishing that this is the time to do it, that just because we're working from home, it's not expected that we're working 24/7, that we're still putting boundaries, that we're using our commuting time and turning that into sleeping, rest time, meditation time. And while we are making these recommendations, we're also offering them free resources that are available to achieve that. So free meditation resources, free navigation resources, free childcare services, and so on and so forth as we move on through this presentation. And one of the most important things, and as we talk about ergonomics here, creating a productive working space, I think all of us see musculoskeletal claims be one of the top 5 drivers in the 90% of the cases we see. So as people readjust to working from home, we want to make sure that that situation specifically, combined with probably poor diet, excessive alcohol intake, does not exacerbate the chronic conditions that we're already seeing on the claims as people start come back and getting care in 2021. So turning commuting time into sleep, creating productive work environment, and prioritizing mental health. And that essentially, from my personal experience, and Patty, you can disagree, but I think it's important when managers reiterate to people that you can, even if you're working from home, you can still take a lunch break. You should still take a walking break every few hours, get away from the computer and spend some time with your family. If you are sheltering in place with your family, as painful as that might be sometimes. But it's important for employers to reiterate that. And we find it carries a lot of weight when it's communicated by leadership a lot more frequently. And because this is the new normal, right, we're all figuring out what is that sweet spot when pushing out communications. Do we over-communicate? How do we manage the influx of the information coming in to people? And we do think that communicating short, concise messages more than we used to, just having a push campaign set up in some sort of way, just reiterating that A, the organization is supporting its employees, and B, that there are continued breadth of resources that are available and any updates you're seeing. Communicating that along with transparency on how your organization is handling COVID-19. So managing the flow of information, staying connected, making sure that people understand that, people who sat next to them 2 months ago are still there. They should still be connecting. They should still be talking as they're working on, as work continues, right? We still want to make sure that people are hearing each other, learning from each other, and getting the right mentorship that they're seeking. And then leveraging technology and establishing virtual ways of connecting, making sure people actually participate in video calls, getting dressed up and getting yourself a little bit more camera ready helps most of us also, as well as we navigate the situation and have the inclination of staying in your pajamas all day, which might not be helpful to our mental health every day. Any questions?
Serena, Serena, I just want to add, one thing that every day, just so in terms of our connectedness, so our CEO has a video every Monday morning that he releases about 7 a.m. And so I know I look forward to that video, and he talks about what's going on in the company, but he also talks about what's going on with him personally. And he also talks about how senior leadership is doing things. So for example, he'll reference our CFO and how she's using her not having to commute time to do an exercise class. So I think that brings us close together, and I think people do look at that video, and it's a nice source of information along with other senior leaders providing information.
And I think to that point, Patty, I mean, I think it's a great way of removing shame when people are working from home and thinking, everybody is looking at me, senior leadership is looking at me, and I should be online 24/7. And when you have senior leaders coming to you and saying, I am signing off at 7 because I want to take some time for myself, that reiterates and slows down to everyone that this is okay to disconnect and to take some time.
Do you have any tips on how to actually say that?
We do actually. We can share some of that with you, and we've been brainstorming, with our management team as well as the situation developed on how to communicate that to our junior folks who were staying online until 9, 10 p.m. Besides just saying, I need you to sign off right now. And it's really working on communication and prioritizing what projects really take priority and what projects can wait, because ASAP is not really a deadline and everything can't be done right away. And I think for us, what has worked is really reaching out to people managers and reiterating to them that we want you to make sure that you are giving the information to the to your junior folks, that not everything needs to get done today, to really think about prioritizing and working on what you need to get done on that specific day, because just because we're working from home and we're connected doesn't mean we have to get everything done right away. And that, I think, is the most important message to accept for some of the junior folks who are also struggling with career growth thoughts and where is this going? Am I visible enough? And thoughts along those lines. Any other questions?
Hi, I have a question. I'm wondering if you're seeing a trend with insurance carriers, or do you guys anticipate that they will be paying for, say, any type of testing, or maybe providing protective equipment or masks or anything like that for employers to give their employee base?
So right now the testing, in terms of the CARES Act, the testing is done at 100%. As well as the testing for coming back to work, the antibody test. So there are certain mandated requirements if you're insured that you have to provide, and many of our organizations are self-insured, but they're following that guidance. So there's been a lot of flexibility in trying not to have any barriers from a financial perspective thrown out to people to get the testing that they need. In terms of PPE, in terms of insurance companies paying for that, haven't really seen that. But that's a lot of the vendors in the community have been providing PPE to employers, as part of a charitable type of contribution. So, providing masks to a hospital or providing this to somebody else. So that's going on. But in terms of the payment and trying not to put barriers on for people to get the testing.
So, some of the trends we are seeing among employer groups is a lot of employers want to know if they can use their wellness stipend, because some do get fully insured and self-funded clients do get a wellness stipend. So a lot of them are asking whether or not they can use it for PPE when they do come back to work, or for any sort of third-party testing before employees come to work, like temperature checks or anything along those lines, even though those have been proven to be not to be 100% accurate. So there is still a lot of conversations ongoing, but I think it all comes back to tracing when we're talking about cities like New York or San Fran, densely populated cities that are thinking about reopening and having people come back to work. Does that help?
Yeah, no, that's very interesting. I'm thinking of like a flu shot, right? So companies could use the wellness budget to say administer a flu shot.
Yes.
So
yes, and they do that now.
Right.
As we continue these conversations.
Yeah, if we come up with a vaccine, I think you'll see people paying for the vaccine. And right now, certain environments, you have to get a flu shot. If you're working in a healthcare system, you have to opt out. And if you don't get a flu shot, you could be grounds for dismissal.
Right.
Yeah. You know, as we continue these conversations and these webinars, we can keep you up to date as to what's going on, you know, when it comes to carriers and whether or not there's a consensus in how they're approaching the return to work, first of all, return to work claims, and then also how are they looking at supporting employers as they're trying to bring employees back to work. Right, whether or not they're allowing some of the wellness funds to be used for PPE, whether or not they're willing to provide some PPE when there's availability and things along those lines.
Okay.
Perfect. Any other questions?
You know, sorry, I was just going to say on a quasi-related note, I think you mentioned this at the beginning, but do you guys have, is there an easily accessible digest of services or you know, sort of third-party offered products that might be usable for those wellness dollars, you know, that maybe before would not have qualified, or just, you know, new things that have come out in the market? Is that something that's easy to access or that you could disseminate?
Mm-hmm.
I can tell you, for example, on a few clients we're seeing, specifically on self-insured clients, we're seeing carriers allowing the use of wellness credits towards their premium fees. So if they're paying a PEPM 6 fee towards their administrative services agreement with Aetna, Blue Cross Blue Shield, we have seen that happening a lot more than we had anticipated. I have not heard anything else that they're doing along those lines. I think it for now is an ongoing exception basis. But Patty, have you seen anything consistent for now?
No, I mean, they're coming out with new virtual apps, digital apps, different ways, you know, making them free of charge, but I haven't seen anything else. But we'll look and certainly get back to you on that.
Yeah. And I want to pivot to this one more time. When we're talking about, you know, telemedicine, we're also talking about telemental health providers that, you know, for example, Aetna partners with Able to, and I think there's conversations happening about maybe offering 1 or 2 free visits to employees, and then employees can establish a direct relationship with that provider and use some of their FSA dollars, but it gives people the ability to talk to an actual therapist over the phone and to get some care for the short term. So absolutely, there's resources through carriers that are available for that as well that wellness funds can be used for.
Yep.
Perfect. And as I mentioned before, so this is something that this and the next slide can be shared with your employees. As I mentioned, musculoskeletal claims or a huge driver among the majority of our books that we are seeing. So we wanted to establish, and I'm definitely not following any of these rules right now as I am sitting, and I'm trying. But how to, when we're talking about establishing a productive and at work at home space, ergonomics are the basics of it. If we're going to be sitting in the same place for 8 hours and we don't really have an entire office to walk every 2 hours, for example, and we can go to the fridge, and that's not enough of walking. So I think it's important to reiterate to employees that this is the guidance that we can offer, and then we are working on sourcing some additional resources that can be available for free through ergonomic providers that are in this space right now, like Briotics, for example. As soon as we get some more headway on that, we can provide that. But for now, I think this is important to share with employees so that they can, if they're feeling pain in a certain area of their body, they can readjust and do some simple adjustments to help alleviate that pain.
And some employers are just allowing people who never worked from home, for example, there may be a stipend that they're giving them to buy certain equipment if they didn't have the setup. And there are a lot of things that are available pretty inexpensively. So
and I say here
that a trend in that.
Yeah, and I say here is where the wellness funds can come into play for some of those groups, right? Using some of that money to help employees or reimburse employees for any ergonomic support that they need. Perfect. If there are no questions, we'll move into some well-being tips. So everything that we've highlighted on this page is a free resource. Everything is linked, so you're able to access it. So we wanted to start with Modern Health and what they offer. And we have a link here to their YouTube page that offers a lot of resources on how to cope with emotional support challenges, financial support, working from home, and things along those lines, specifically as they have become exacerbated during the COVID-19 pandemic. Headspace, I think we're all familiar with Headspace. They're providing a free resource right now to employees and employers and to the public in response to this crisis, in making sure that they've unlocked additional content that people can use. Meditation can be super helpful in setting up the stage for the day for employees, or in helping them decompress, especially again if they're sheltering in place with families. It's especially also, I think, important to teach kids, and this is a good opportunity to provide them with that resource, as most have phones and computers nowadays, to start meditating and to start exploring the space as well. And then Mind Your Mind. Mind Your Mind is actually an Aon client resource that's available for free that we wanted to share with you. That's available for both parents and young adolescents. And they're offering specific Spotify playlists if kids wanted to download that, young adult speakers, and how to stay engaged, how to stay on the right track, and what sort of resources are available, and just giving young adults a little bit of transparency as to what's going on during this pandemic that they may not be getting from Twitter, from their parents, or from the news, and just really putting it in terms that they can understand and digest. Any questions here before we move on? And then we wanted to also talk about some navigation support and transparency tools. I think we've all heard of, DirectPath, Castlight, and vendors like that, but we wanted to highlight free resources that they're offering to everyone, right? So DirectPath had created a helpline and a service line for employers that can reach out to them for free. They just gather simple information, and they can set up a database for your employees that they can access to see what services for COVID-19 are covered, some of the basic questions on symptoms, and some of the resources that are available in their specific area. So this is for free and for the next 90 days. I think every vendor that's offering free resources is going to be reevaluating how long they're going to be offering free resources based on how long this situation continues. And same thing goes for Caslight. You know, they set up a nationwide directory on testing sites, and I think in New York specifically, with the expansion of COVID-19 testing and then specifically antibody testing to local pharmacies, this is vitally important to make sure that employees have the appropriate resources in finding out where they can get tested.
And the insurance companies just today, I believe Cigna rolled out a new service that you can just go on and figure out where you can get the testing as well. So definitely be checking through your insurance company as well.
Yeah, and we absolutely want to say anticipate a lot more antibody testing than you would COVID-19 testing for a couple of reasons. In New York City, for example, COVID-19 testing is still pretty hard to get approved for. But it's also, the antibody testing is a little less invasive because it's just the blood draw, and it's simpler to get done in a doctor's office or in the urgent care facility, or you can go directly to LabCorp. LabCorp sent out an email today to everyone saying that, you know, they are now offering antibody testing, and you can make an appointment and come in and get it done at one of their labs. Any questions on this before we move on?
We have kind of a general question that came in. Somebody's wondering, if you're concerned with a specific employee other than pointing them to resources, is there anything else you suggest we can do?
Legally, you mean? Yeah. Go ahead, Serena.
In what sense? Are we talking about their mental health? Do they need legal help, or?
They weren't specific. Whoever chatted the question can maybe wants to put more specifics into the question, but most likely just support them in other ways. I'm not sure. Why don't we come back to that question when we have more specific? Okay.
Absolutely, and you can share Patty and my email address if this person wants to ask in confidentially. We're more than happy to help.
Okay, great. Thanks.
Perfect. So continuing on navigation support and transparency, right, we want to talk about eVibe and Childcare. So the idea behind both of these is the same, right? Providing employees with resources on where to find testing, resources on what COVID-19 looks like, and how to react if you suspect that you have a case. And the reason why we wanted to outline a few more of these is because we see more and more employers partnering up with navigation support vendors. While these resources are free, there is a breadth of resources that are available for those who are clients already, and I think we just want to make sure that people ask exactly what's available. Again, because the situation is so fluid, because the carriers are also still playing catch up, the vendors are still playing catch up, we want to just make sure that the questions for those who are clients currently are out there and they're scoped out properly. And then this is the Happy Kids, Happy Parents slide. So a couple of things here, and I think the virtual field trip resources is what we wanted to focus on. It's pretty cool. Some of these are free. Some of these cost about $5 to $10. The Great Wall of China was kind of cool. I did that. It's $10 or on a donation basis. On whatever you can afford, but it's a good way to occupy kids and young adults and making sure they stay engaged and their interests are still supported. And then Varsity Tours and Scholastic, they offer a lot of free daily projects for kids, free online resources, free classes, and games and interactive games, more or less. So this is something that we wanted to reiterate in case you have a Zoom call and you need to keep your kids busy. Some of these resources can be used here just to keep them engaged. And for those participants who are working from home with children, what are some of the challenges that you are seeing, if you're willing to express some of the challenges you're seeing, some of the things that are not being addressed for you as you navigate this space?
For me personally, I can add that I see a lot of efforts towards young children, but I have a 16-year-old daughter that I find very hard to motivate. And although, you know, she's doing well in school and she's motivated in that sense, otherwise it's like moving molasses. I can't get her to do anything.
Yeah.
Yeah, that's tough. That's tough.
That's tough. Mind Your Mind might be a helpful resource for you and her. It's linked in this presentation, so feel free to check it out. I think it's more, it's directed more at young adults and, you know, from 13 and above. So hopefully she'll find something of interest there. But yeah, you are correct. A lot of it is really geared towards small kids and toddlers versus young adults.
Yeah. Does anybody else have any things they're using? Okay, I have a question that came in. Any trends you're seeing with your clients that you think are best practices for employers that we should do?
Making sure that people have the resources. I think that's, you know, number one. A lot of the clients that I work with, you know, have a web page that's dedicated to the resources that they put into place. And when we provide them new information, they're putting them up. I think the problem is that people have to go there. So the more you can communicate and make sure that people know of the availability, the more they're going to get used. And if there's a way to do some push messaging, I think that would be really helpful. Constantly remind people.
Yeah.
I think it's sort of this line that we're all straddling of over communicating and turning people off. You can't do the desk drops. You can't come up and have a conversation like we used to. So really keeping messages short, having everything linked, and making it easier in this, you know, technological world that we're in, just making everything easier and more accessible while offering transparency is definitely going to help in the long term.
And we did have one client, actually wasn't our, well, it is our client actually, that a best practice for childcare, they basically, when childcare closed, they gave people, I think it was 4 to 6 weeks paid leave, because they understood that the person really couldn't be working. So it was an enormous relief for those individuals to know that it was okay to take the time off during that time, and really allow essentially the other parent to focus and not have to do the balancing act all the time. So I think people are looking at that. We've also heard about people going, it may be commensurate with a reduction in pay, but going to a lesser work week. So going to a 4-day work week, but you're getting 20% pay, which a reduction, but at least there's some balancing. So I think people are doing the best they can in terms of that. All right.
You know,
any other questions?
I have one question. I don't mean to be overly tactical, but we have certainly peppered our employee base with memos, you know, summarizing, like directing everyone's attention to the COVID wiki page that we created, and, you know, maybe highlighting one thing or another thing. But it is really, really hard to actually get engagement, and everyone's inboxes are just overrun. We're all staring at screens all the time. Like, have you guys come across any creative ways to, you know, to get your employees to engage with these resources that isn't just sending an email or creating a wiki page no one goes to?
some of the ideas we're talking about is, and I'm not sure if you've explored that, but SMS push notifications. But we just have to be really careful in how we deploy, right? That resource when it's available, when employees are giving us their cell phone numbers. The thought process behind it was when you're developing a wellness program, you develop a communication plan that addresses, let's just say, that monthly topic, wellness topic. So this is, dental health month. You can do that now by saying, this is mental health week. This is what we have available for you. Or this preventive screening week, and during COVID-19, what should you be worried about? Or here's financial wellness week, and just keep your notifications to one topic, making sure that people keep a little bit more engaged. You are right, the inboxes are a little out of control. The influx of information from all sources nowadays is a little challenging, and I think everybody's struggling in figuring out how to navigate and what tools to deploy and at what frequency.
And I have a question. I think we all weren't aware of how important the so-called water cooler talk is to our psychological.
That's
do you have
right.
tips and tricks for employers to use and do in this time to kind of substitute and bond people together?
So we do we do a couple of check-ins at different levels. For example, at Aon, but we do have a happy hour every week where people still engage, people come on, and again, if leadership is involved in that happy hour, and if there's some freedom for people to feel like they are in a bar, and they can sometimes behave a little freely than they would otherwise because they're on camera, it helps people let off that steam and continue the conversation and talk to each other on a weekly basis, because they still do see each other weekly.
And we have check-ins with all of our direct reports. So like Serena said, it's seeing upwards and downwards, and we're on IAM all day, checking in with people, making sure that they're okay. So we really do a lot of that. And yes, we miss the water cooler. On the other hand, you realize how much time you spend at the water cooler. So, there's in terms of productivity, but we miss that. So that's the balancing act.
Right. Do we have
any other questions? Perfect. I'll pass it on to Patty for a return to work roadmap, just a quick outline before we wrap up.
Right, and this is now on everybody's minds, as we know, as we're preparing. It may not be in New York, but you may have locations in other places. We have a lot of national employers that we work with, and so it's very tough. There's a lot of considerations. There's commuting patterns. There's who owns your building that you're in. Today, we were talking about the fact that in our company, we have offices in Stamford, and we have offices in Stamford, New York City, and New Jersey locations. And the big question for us is the elevators, and how in New York, we need to use public transportation to get to work, and we also need to get on an elevator. In our suburban locations, you can drive to work and you don't need to get on an elevator. So things like this, just the process of getting into your workplace is so different. And so these are factors that we have to consider in every one of our locations. And then in terms of creating a safe work environment, it's not just the people that we work with, it is the people that are in the environment that we're in. So early on, we got reports in our building. There were 12,000 people in our building in Lower Manhattan, 12,000 people that go through those turnstiles every day. And quite frankly, we only got one notice early on that there was one person that tested positive. But trying to create a safe work environment where everyone can coexist. Right now, we're in an open work area, whereas we used to be in offices and higher cubicles. Well, we can't be safely 6 feet apart. So how are we going to do that? And we're talking about coming in phases, potentially looking at not everybody coming in together. So we may have Monday, Wednesday, Friday people and Tuesday and Thursday people, because there is no way we can separate. And then, do we need to be wearing masks and gloves in the workplace? Everything is this open space, and with the way COVID's passing, I mean, that's a consideration. And thinking about coming to work in New York, wearing a mask on the subway and train, and then coming into your office environment and continuing to have to wear a mask. So there's a lot of considerations, what we're going to do from a building perspective. We talked about temperature checks, other things, how frequently are people going to need to be tested. In terms of return to work from quarantine or illness, we already had that in place a long time ago. So I would think that most people have some travel restrictions, and it started back in January when we closed the borders with China. And we have a lot of people that went back to their country for Chinese New Year. And when they came back, they were put in quarantine. And in fact, that quarantine was extended over time as the information extended. So there's a lot of considerations there. And then there's people, a lot of organizations that we work with have been furloughing people. And what does that mean? How do you know when you can bring them back? Not just from a safety perspective, but from an economic perspective as well. So there are a lot of considerations we're having. Obviously, here are the key success factors, many of which we've already talked about before, but we know that all levels of the organization, our real estate group, our safety group, and all of our office leadership are very much involved in this and talking to our landlords. And it could be at the end of the day that we're looking at a new normal, as we've been talking about, and maybe we'll just have hoteling and we won't have a definitive office. And I think the other thing is that we're talking about is if someone doesn't feel comfortable coming into the workplace, can you really make them? We don't have the answer to that question yet. I mean, if your job requires it, yes. But if your job doesn't require us, like most of us are working remotely now, if I don't feel comfortable going into that workplace, is there a requirement that I ever have to go if I don't feel safe and feel that my company has done enough? So there'll be a lot of legal considerations that we have to think about going forward. And I think what we find in terms of potential common obstacles are the transparency, that you haven't really set the stage in enough time to let people know what the plans are, because now with children home from school, this is a huge issue for parents, what they're going to do. And if they both need to go back to work and there's no childcare available, how that can work, and being very proactive, being out in front from a leadership perspective, which we're definitely doing in our organization, and we see it with our clients as well. But there's so many unknowns right now that it's a difficult time in terms of trying to figure out how you're actually going to stage this. And I think the testing is going to be very much important in terms of how we stage this. And what are the resources? How many times are you going to test somebody? You know, and can you control what somebody does on the weekends or for their vacation? So those are all key considerations.
So I think, and just, oh, sorry to interrupt. I think all of this is so interesting. Like we started, you know, I don't know, a couple of weeks ago when generally across the country, people started to talk about this whole idea of reopening or returning. You know, we started that conversation too, but really quickly, it just became clear that like everything we're touching upon here in this conversation, I mean, there were just a million questions in any number of directions that we don't have answered and that would need to be answered before we could actually have a plan to get people to come back into a New York City anyway, in particular office, right. But even other offices in other states and in other countries, because you know, some very basic things like even if you could reconfigure your office space and even if you could stagger employees to come in shifts, you don't necessarily have control over the bathrooms. you know, a lot of times that's a landlord issue, and there's no way, like for instance, our bathrooms, New York City office, it would just be, people couldn't be 6 feet apart. We don't have contactless everything. Like we'd have to just basically renovate the bathroom, I suppose. But even if you did that, you would have to only allow in one person at a time. It's not practical. So, you know, things like that, you start realizing, where the elevators, or, you know, even if you could get your office space perfect, then how could you require people to get on the New Jersey Transit or get on the subway?
Right.
Because if your office is safe, if they have to get on the subway, you can't guarantee that's safe. So, so I don't know. So it's really amazing, because then I see your point here that stakeholders, you know, they're not aware of the plan, and that uncertainty and lack of transparency is creating problems. We're experiencing that too. We want to have transparency. We want to have a plan, but how can we? So I guess I'm just wondering, like Aon, you guys are so large. You are seeing what so many employers are doing, you know, worldwide. I mean, are you actually seeing employers start to have concrete plans of any sort to get people back into offices?
They are having conversations just like our organization is having them. You know, they are working on the plan, but the problem is that there's a lot of things that go into that plan that are not yet concrete. So they're working on the plan. They're thinking about it, because it can't happen all of a sudden. I mean, we in terms of how it rolled out in quarantining and not going to work, that happened very quickly. There wasn't a lot of runway, but now we have to do this return to work very well, because we know about the virus. So there has to be more of a runway. And I think they're considering everything. The legal implications, the real estate, the cost, the control issues, the spreading the virus issues. I mean, all of these things are factoring into it. So I think this is, the coming back to work is the harder part than staying away from work, quite frankly.
And to that, I do want to add, right, Breen, to Aon's take on it. The level of transparency that our leadership had offered to us in terms of what sort of complexities they're dealing with when they're reevaluating coming back to work has been important to me, for example, and I know to more junior folks, because they understand that the leadership is struggling with that as well. And the leadership is struggling with that. They're keeping us connected into what sort of challenges, right? How do we keep people, 2 people per elevator? How are you going to work through all of these challenges? I think it's important to make sure that conversation and that clarity is given into our earlier conversation, right? The lack of clarity that people have in transparency in today's world and with this situation, the more transparency we can give them as to how we're dealing as employers and as leaders with this situation, it will afford more comfort whether or not we realize it. It would afford more comfort to those who are struggling, you know, who are sick, who may have COVID-19, who just have depression given what's going on, financial difficulties, care duties that they have to their families. I think that's important, just to have at least one source of transparency that's given to you as to what's going on with the most important part of your life, and that's your paycheck, right? That enables you to sustain everything we do. So I just wanted to add that one more bit on the importance of transparency as we're sort of navigating this. The other thing I also want to mention, I know it's not going to happen in states like New York or California, but there are conversations among, let's just say, Texas governor has brought up a suggestion that refusal to come back to work after the state has implemented return to work and reopening the state can serve as a reason for termination. So it basically gives employers this carte blanche to terminate you if you don't want to come back to work, if you don't feel safe enough. And I think as those conversations develop for those who are participating in this and have people present in those states and have a footprint, it's important to keep people engaged in reiterating that even though this may be the regulation, we may not be taking this route, reassuring people that the security we've been talking about is still there. Any other questions?
I think we're coming to the end of our hour. This has been fascinating.
Right.
Thank you. I think I'm sitting a little bit straighter, but not quite sure how. I'm
Same
sure
here.
we'll be working on it. Okay, so thank you so much, Patty and Irina. That was great. And thank you, Aon. Aon's been such a great supporter of ours and our mission, and we're so grateful for you. So some real quick housekeeping. We have some great events for next week. We have Emily Green coming from Ellevest to talk to us about founders and investments and angel investing. And thank you all for joining. This has been a really interesting and great conversation, and I hope you learned a lot and hope to see you soon. Thank you.
Thank you so much.